What's up, YouTube? Welcome back to my channel and back to another video in the virtual travel nurse series. If you are new here, my name is Ava and I'm a registered nurse. So today I'm taking y'all along with me for a day in the life of a virtual travel nurse. Just take y'all through my day-to-day and what I've learned and what I'm doing so far on this assignment. I've been on this assignment for 1 month. I've got 2 more months to go. It's 13 weeks. I have already asked for an extension because I am enjoying it so much. The assignment is in Richmond, Virginia. I'm from North Carolina, so it's about 3 hours from home. So on my days off, I go back home, see my baby, and then I come back to Virginia and make my money. This contract has been low stress and it pays fairly well. I'll make a separate video talking about how much I made in 1 month. But let me lay the foundation so y'all know exactly what I'm doing as a virtual travel nurse. So I was recruited for a hospital system to be a virtual nurse for their hospital at home program that they are building up. So hospital at home means we take certain patients from the hospital and we let them finish doing their treatment at home. So that's a new option available for patients. And a working option for nurses. So you can do virtual nursing and be the virtual nurse, or you can be the hands-on nurse going to people's homes and delivering the care. I personally chose virtual nursing, but I'll always choose remote or virtual work. And that leads me to the sponsor of today's video. NursiConnect is a remote nurse staffing agency dedicated to helping nurses find remote work as well as place nurses in roles for organizations who offer remote nursing. The roles we look to fill are inpatient virtual nurses, case managers, and psychiatric nurse practitioners. If you have experience in any of these areas, please submit a resume for general consideration. Not only does NursiConnect fill remote nursing positions, they also offer virtual nurse training. Acute care virtual nursing training is now available. This is a growing specialty and a newer specialty in nursing. So they offer training. To get additional 10% off of the training, you can download the Virtual Nurse Overview, which is highly recommended. This Virtual Nurse Overview gives you more insight about the role to make sure it's something you want to pursue before taking the course. Everything will be linked in the description below. All right, now let's head back over to the video. All right, so first things first, we're gonna grab our lunch and go ahead and make our commute for today. First thing I do when I get onto the unit or when I come to the command center, I look at the assignment sheet and see who my patients are and how many I have. Most of the time, I have anywhere between 3 to 4 patients. The most that this unit can take right now is 8 patients, just because mapping out how far it takes to get people's homes and having enough staffing. So right now we can only take 8 patients. So sometimes I'll have 4 and the other nurse will work with me and she'll have 4 as well. After report, I'll call in and introduce myself to my patient and I'll give medications if I need to. Now, giving meds just means that I'm verifying that the patient is taking the right medication at the right time. They'll show me the tablet or the cream and I just verify that it's correct and the doctor order it for them in Epic. And then I just mark that I observed them take it. If they need IV medications, then the visiting nurse will go ahead and administer those. I'll also be available if the visiting nurse needs a dual sign-off or if they need to waste narcotics with me over the tablet. So the way the patients get their care is they go home with a tablet, and basically that tablet acts as a call bell, and they can call us anytime, 24/7, 365. Now, the diagnoses we usually get on this floor, it's basically med-surg. So your pancreatitis, your UTIs, cellulitis, we can take those patients and treat them on IV antibiotics. We can also take patient transfers. So a patient can transfer from a step-down unit. I can take that patient and I can also get report on them and then just kind of update the visiting nurse what they can expect when they go into the home. Now, this room is where we have our meetings about the patient or our disciplinary rounds, or they call it IDT, interdisciplinary round. And we just talk about, what patients need what, who's ready for discharge, if we're getting any new transfers or admissions, Just really making sure we're addressing all the patient's needs while they're with us on the unit. And at this point, this is a good time for nurses or any providers to bring up concerns they have about patient care or patient safety. Around this time, I usually take a lunch break. Lunch is still 30 minutes in a 12-hour shift. But for the most part, I be chilling until we have something where it's not so chilling. Like sometimes we do have to send patients back to the brick and mortar hospital because they've started to have an event. But that's about as stressed as I get on this contract. It's still 12-hour shifts, 3 days a week. I'm strictly on day shift right now, but I did pick up a few night shifts because the overtime rate on this contract is very nice. So when I can pick up, I definitely will. Once I get all my patients settled with hospital at home, I will switch over to another program they have, which is RPM. RPM means remote patient monitoring. So we're monitoring patients' blood pressure, blood sugar, weights, and then I would just call those patients if anything is out of whack. This position is definitely for older nurses. My coworkers are more experienced than I am. They are well of aged nurses. I am probably the youngest nurse on the unit at the age of 26. There's another person that started too with me. He's pretty young, but it's just us two. But everybody else has like decades of experience and a lot of seasoning. It is getting closer to the end of the shift, so now I'm just getting ready to give a report to the night shift virtual nurse. I'll just let them know any events that happen throughout the day, patients' labs, if the doctor made any changes on their medications, if we were able to help get the patient care aids, and sometimes we're also able to help the patient get meals if they don't have food readily available at home. I'll also let the nurse know if we had to send the patient back to the hospital for any scans or procedures, or if they had to have any transfusions done today. I'll also notify them about any social issues that the family and the patient may have, because that's a very big deal when you're doing home care with people, because now you're coming into their environment. They're not adapting to the hospital environment, so we really have to share that info. But y'all, that is how my shift usually goes. I am very happy about this assignment. I get off work very relaxed. Let's get ready to go home.
Y'all, I made it back to my spot, and now I'm gonna try to cook some spam, noodles, and I got some eggs going. So let's go ahead and make some dinner.
All right, my dinner is made. I'm about to tear this food up. As soon as I do, I am going straight to sleep because I do have to work again tomorrow. I have a projector in my room, so these are my views for tonight. Thank y'all so much for watching. I will see y'all in the next video.